Good afternoon and good morning, everyone. My name is Lauren Ripplinger. I'm the Chief Public Policy and Impact Officer for the American Health Information Management Association. And welcome to the third in our AI series. We are going to be covering the topic of governance in AI today. So as many of you all may know, good governance strategies will enable healthcare organizations as they strive to capture the benefits of AI, but also mitigate possible risks. Today, we're going to learn from a set of experts in the field that are learning by doing. And some of the insights we're going to talk about today will range from creating inventories of deployed AI solutions to conducting risk analyses of new technologies and instituting multifunctional teams to provide oversight and reporting to executive leadership. I'll pause here very briefly for you all to read through our disclaimer, but also just to share a reminder that this webinar is for informational and for educational purposes only. We encourage you to ask questions throughout the course of this conversation today. If you have questions, I encourage you to put it in the Q&A section of the Zoom platform so we can make sure that we can get to those. So I hope you all have come ready with many questions for our panelists today. To further inform our discussion, I do want to share a couple of data points today from a survey that AHIMA conducted with NORC at the University of Chicago late last year regarding the workforce and AI. The purpose of this study was really threefold. First, it was to understand the specific workforce challenges that impact the health information profession. Second, it was to assess the role that emerging and evolving technologies like AI and machine learning will have on the health information workforce. And finally, it was also to leverage insights to develop policy recommendations around workforce development. So some of the findings that came out of that survey, one of the things that we found from respondents was that today, less than half of respondents reported that they are using AI in their own departments. Some of the reasons for not using AI included lack of funding to purchase the technology. The technology didn't necessarily fit within the workflow of existing platforms. And then finally, a lack of organizational policy or governance framework to implement the technology, which we're going to talk a lot about today. The other data point I wanted to share, though, is knowing that current use, 52% of respondents said that they plan to increase the use of AI over the next 12 months, with 47% saying they're going to essentially keep it the same in terms of how much they're using it, and 1% only saying that they plan to decrease use of AI technology. What this tells us, though, is that the uptake of the use of AI tools is not going away. And so we really need to kind of figure out this governance piece. Today, we are joined by a distinguished set of panelists to talk about AI and governance. Joining us today are Dr. Adam Landman, who's the Chief Information Officer for Massachusetts General Brigham, and Alia Suleiman, who is a partner with McDermott at Emory. I'll also share our third panelist, Ammon Fillmore, who is the Chief Legal Officer at Advent Health, was supposed to join us. Unfortunately, he became ill earlier this morning, but we know that he is with us in spirit today, and we're still going to have a great discussion. So with that, I'd love to welcome our panelists. Thank you both for being here today.
Thanks so much for the opportunity.
Absolutely. Yeah. Well, why don't we kind of dig right into kind of our discussion? I'd love to ask you both, to what extent do these survey findings that we just talked about around the lack of governance framework resonate with you all based on what you're seeing within your organizations and your clients? So Alia, why don't we start with you?
Yeah, no, happy to get us started. So people are overwhelmed is my general impression as I work with healthcare organizations across the industry and even some digital health companies that are on the front lines of developing some of these tools. They're overwhelmed in trying to keep up with how the technology is evolving as well as the regulatory landscape. And what is just now starting to, I think, catch on with folks is that you don't necessarily need to create sort of a separate AI strategy. You need to think about how artificial intelligence complements your organization's existing strategy, your existing mission, your existing goals, and prioritize everything that's emerging in the market kind of based on that. One of the key things that I'm seeing folks kind of focus on is just trying to make sure that their house is in order. And this is something I highly encourage, like that your house is in order from a data governance perspective. Do you know what data you have and how you can use it in connection with some of these tools? Do you have a process in place so that when ideas involving AI tools percolate up, you can assess them using hopefully a cross-stakeholder and multidisciplinary approach? Those are kind of foundational questions that at least make it so that the organization, usually in a centralized function, can be aware of what sorts of ideas, initiatives are coming up. And part of that, kind of implementing a system like that requires just some baseline education and upskilling for the whole organization on what these terms even mean, like how the organization is going to define like AI when it comes to things that might rise to the level of requiring additional scrutiny, additional governance touch points, because frankly, like not all of these technologies are created equal. And I've seen some regulatory frameworks and state laws that would qualify conditional formatting in an Excel spreadsheet as AI. And I don't know that that's really the best area of focus for a governance function. But I'm curious, Adam, what your observation has been and how things have been emerging over at MGB.
No, thanks, Alia. Much of what you said resonates. I also really appreciate the thoughtfulness of the response to the survey, because I'm glad that some are sort of taking a moment to pause and say, maybe there should be some governance before I start to use some of these tools. So that's important because we often see people just marching ahead, not thinking through some of the consequences. But to build on some of your comments, Alia, I'd say that there's sort of a continuum of risk with these solutions. They're not all the same. And so where we're starting is trying to start on lower risk use cases with AI, and certainly in healthcare, a good example of that might be call center automation. So potentially using AI agents to help direct our patients and visitors that are calling our hospitals. And if something goes wrong there, the person might get directed to the wrong place, and they can simply call back and even speak with an operator. And so there's not a huge risk there. On the other hand, there's a lot of excitement about some of the more sexier uses in healthcare of AI, such as like triaging patients or helping make a diagnosis. And I would say those are much higher risk. If the AI is not correct, a patient could actually suffer harm. They could have a delayed diagnosis or even receive incorrect treatment. And so those we would want to have much more significant governance on, validation. Those AI tools might even require FDA approval. And then I think right in the middle is kind of a set of use cases that I like to refer to as sort of clinical decision support or workflow support. And those are often solutions that work alongside a healthcare professional or expert providing some advice. And then the expert reviews that advice and decides whether or not to move forward with it. And an example could be, radiology decision support that might be doing computer vision on images and maybe suggesting that there could be a nodule on a lung CT, but the radiologist ultimately takes that information into account and makes the decision on it. And so I think we do that now with different forms of clinical decision support. So it's an extension of what we're doing, but I think that falls in the middle of the risk spectrum. So, overall, as we're thinking about governance and risk and accountability, we like to think of it in terms of this kind of risk continuum.
Alia, any additional thoughts on that?
Totally agree on sort of the emphasis on high impact, low risk use cases to get, sort of your organization's risk tolerances and approach to AI deployment figured out. And one of the things that we're seeing a lot of folks experiment with are different sorts of even internal use cases, like chatbots that answer questions about organizational policies and procedures. It's a really, honestly, great way to get some experience working with some of the popular, publicly available, enterprise foundation models, figuring out how exactly you need to prompt and configure them so that they stay within their lane, and also save some time for compliance professionals like some of the folks on this call who might otherwise have to answer questions about those policies. So I know my firm McDermott has experimented with a beta chatbot that has this very defined purpose of use, answering questions about particular types of policies. And I do think that it has been a great learning experience for the organization to get familiar with these tools, understand their limitations as well as the opportunities. And so one thing I just generally recommend is pick something, Adam, to use your words, high impact but low risk, something where a bad outcome or a wrong answer is reversible or addressable in a way that's low lift, to just get the organization more aware of what it looks like to actually do this responsibly, and what sorts of factors that need to be considered, frankly, to ensure that this thing operates in the way that you've intended it to. And hopefully, in the case of the policy chatbot, says, sorry, I can't answer that question about what like what you should do next from a treatment perspective for your broken arm or a bloody nose. Like, those are to clearly define like what's out of scope has been really critical for some of these explorations. And it kind of goes back to, I think, a general guiding principle that I always try to keep in mind is have a really crisp definition of the thing you want to do, the problem you want to solve. And keep that in mind, like throughout the entire life cycle of evaluating a product or a tool or developing something internally. Keep that problem statement in mind so that you have something to judge or grade yourself against when you're being asked, at the other end of the spectrum, like, did this work? Is it effective? Is it reliable? Is it performing as expected? Like, without a kind of clear problem statement at the front end, it gets really hard to answer those questions at the back end.
Yeah, Alia, can I just build on one of the other excellent points you just raised? I think your point of a comparison is really important. We have to think of what is the gold standard right now, and we're often trying to hold AI to perfection standards that simply don't exist right now, right? I saw some of the questions and comments on the call center, and I'm even just talking about routing calls. We have to look at AI may fail, and that may be disappointing to patients, but we have to look at the current state where we're not answering many of our calls. So our patients actually can't even get through to us because they're literally, they're on hold for like potentially hours, or their call gets disconnected. And we also have to look at the error rate among our humans, because there's a human error rate. So I think it's really important for us to assess all this. And there were some really great comments about testing it with the population. I completely agree. We're actually taking a trial-informed approach to implementing AI. Maybe it comes from our roots as an academic, an integrated academic healthcare system. But if you think of what we do for medical, interventions, we put them through clinical trials, and they have to have robust evidence before they're used and sometimes approved. And so we're doing the same thing with AI. We're starting with kind of a phase 1 trial in a small group of the appropriate target audience for that AI, and just trying to assess safety and validity of responses. And if it kind of passes that phase 1, then we do a larger pilot, a phase 2 pilot, where we're expanding the number of people using it and the number of workflows, and really assessing the experience and continuing to monitor safety and effectiveness. And then if that works in phase 3, we would potentially scale the intervention, and in a phase 4, monitor for ongoing safety issues, and also recognize the unique characteristic that some AI is learning and evolving over time. And so even if it was safe in the beginning, that could change. And so you need to develop new monitoring over time and continued governance over that monitoring that's actively reviewing the monitoring to make sure that the intervention is still safe.
So Adam, you kind of opened the door, right, for the next question I'd love to ask, which is obviously Mass General has been using AI tools, perhaps longer than most organizations of people that are on this call today. How have you approached the issue of governance around the use of AI tools?
Oh, thanks. It's a very important question, obviously foundational to what we're talking about today. I would say one thing is we're using our existing policies, our existing security standards and data standards and cloud standards that we already have policies for. And we actually provided some additional guidance to our community, specifically with the sort of advancement of large language models. And our general principles are ideally we want our employees and teams to kind of come to us with requests for new technology so that we can provide approved products. But we have a governance process to prioritize and then review those. But we also recognize that it would be impossible to sort of say to employees, don't use the publicly available AI and ML tools. And so we provided some additional guidance, really sharing that it's not appropriate to use PHI or PII or medical record data with publicly available tools. And we went further to create sort of sandbox environments where our employees or our researchers could leverage these tools, the open foundational models, in a secure environment that protects our data. We're a little bit of a special use case because we do have a very sophisticated research community, and so we wanted to cater to their needs by creating sandboxes. And then also wanted to create avenues for the entire organization to be able to get access to tools. And we are also starting to pilot some solutions that offer some of these tools to our employees. So for instance, Microsoft Office 365 Copilot embeds some of these large language models in a safe way inside Office tools so that our employees can use these tools with our data and with sensitive data in a safe way. The data stays within our secure environment and doesn't pass on to Microsoft or OpenAI or other companies, but lets us get the power of the large language models. So those are a couple of ways that we're starting to allow use of these tools and create incentives for using secure and create sandbox environments for using them in a secure way when it involves patient data.
And can you talk a little bit about, my understanding is you kind of have a governance committee that, helps with these conversations. Who sits on that committee out of curiosity?
Yep. Excellent question. So we actually created kind of a 3-tiered, not just, we can't be as simple as just like one committee. We had to create a whole structure around this. So we created kind of a 3-tiered governance structure. The highest level is kind of our highest level AI governance committee. That committee is really focused on developing a responsible use of AI framework to guide the organization, really thinking high level about risk mitigation and staying abreast on what's going on in the industry and other groups. That group is populated by some of our most senior leaders in the organization. So it is led by our Chief Medical Information Officer, and it has representation from the Office of General Counsel, from compliance. It has our Chief Information Security Officer, our Chief Information Officer, has representatives from our data and analytics team, and it also has representatives from our Chief Medical Officer and Chief Quality Officer. Because we're also a research organization, the number of members of our research community that also sit on that committee, our Chief Research Information Officer, our IRB leader, and one of our Associate Chief Academic Officers representing research and research compliance. Then finally, I would say we're also fortunate to have incredible expertise in ethics, and so we also have an ethics member in that group. So that group has a diverse kind of multidisciplinary stakeholders at that senior most level, making high-level strategic decisions and kind of monitoring the program overall. Right below that committee, we have an AI implementation oversight working group, and that's the group that is reviewing all of the use cases that we have going in maybe in various stages of pilot. They ultimately make the go, no-go decisions, so they can stop a pilot. They can also endorse that pilot being scaled, and they have accountability for monitoring those tools over time. And then below that, there are individual project teams that are actually executing the specific use cases. So for example, there's a team working on the Office 365 Copilot pilot, and they're running that. And then they dock into these other governance groups. So it's a layered approach. Hopefully it was clear. I apologize. It may be difficult explaining it, but hopefully I made sense.
Yes, you did. Excellent. That's very helpful. So I'd love to ask both of you, what are some of the challenges that you've seen at your organization or with some of your clients that have sought to implement a robust governance framework around AI, but also what has worked well? Alia, I'd like to start with you on this question.
Yeah, so I just want to like kind of double click on something Adam said, which is, that don't stop, steer ethos around generative AI tools has been critical for a lot of the organizations I work with, because you aren't going to stop curious enterprising individuals from wanting to experiment with these tools, and kind of rightfully so. I read something recently that said, AI is not going to take your job. Someone using AI is going to take your job. And it tapped into a very real fear that I think a lot of us have about, staying up to date and knowledgeable and sort of aware of these technologies. And I think organizations have a really important role to play in empowering their personnel to use these things in safe, controlled ways, whether that means a dedicated instance that maintains the confidentiality, privacy, and security of the information you input into these tools. Or, at our firm, we have, if I try to navigate through a web browser right now to ChatGPT or to Anthropic Claude or Google Gemini, I get a little pop-up that says, hey, you do know that we have a dedicated kind of Microsoft Copilot instance that you can use instead. Please don't put in, and the pop-up reminds me every single time, do not put confidential information into these public tools, because there is no duty on that these developers have to maintain it confidentially. So sort of making it as easy as possible for individuals to know what the right thing to do is. One of the things that has also worked really well has been creating a acceptable use standard. And I'm not calling it a policy, because it doesn't really, it's really more of a living document that I feel like policy doesn't quite fit. And the way that we and other organizations have implemented this is to have literally a page on our intranet that everyone can access that says, here are things that people are doing with the generative AI tools that are available, but both public tools as well as sort of organization specific enterprise tools that have been kind of white labeled for use. And here are the guardrails that they're using to do these things. So for example, taking a blog post that you've written for the company website and translating it to a different language and getting that first draft done by a generative AI tool, generally fine. Then people have greenlit that as an okay use case. And it really is like that level of detail that seems to be most actionable for people. And the more you can surface that in a transparent and accessible way, so folks know exactly, what is okay, what isn't okay, and frankly can go to that resource for ideas on how they might be able to use these tools to make their lives easier. That has been one of the most powerful kind of tools that I've seen organizations use to engage folks with the technology and with the organization sort of overall strategy to hopefully foster adoption and some innovation with the technology. It's been more effective than anything. But I think challenges wise, I like the folks who get a bunch of people together to just like create an AI governance policy in a vacuum without being able to think about what actual use cases are interesting and strategic for the organization. Like, what are our priorities? What are the problems we're trying to solve? Like, the AI governance policy in a vacuum is almost always like a kind of useless first draft. Like, people don't know what to do with it. People don't know what it means to use AI ethically. It's like, okay, what does that specifically mean? You know, or use AI for what it's intended for. It's like, well, that's not very actionable. Like, what I would remember is if someone told me, and you know, someone has showed me this, like, do not use ChatGPT as a calculator. Like, it, you know, its accuracy rate when multiplying or adding numbers that are more than 1 digit each falls off a cliff because it is not a calculator. Like, use your calculator to do those things, or Excel. And that level of, you know, kind of use case discussion, like, what do we want to do? What can these tools do? In some sort of a preliminary workshop on use cases and strategic priorities for AI for the organization. Having that conversation, bringing the right stakeholders in, hopefully getting some collateral out of that conversation that you can disseminate to other teams, has been super helpful so that people can sort of they can think through like the tough questions from a governance perspective with specific use cases in mind. So it's less abstract. It's more like, okay, if our end goal is, you know, to go back to the call center example, we want to route calls more efficiently. We want to be able to identify, you know, which calls need to be triaged in a more urgent way and make sure that they are answered. Like, if that's our end goal, you know, like, what does it mean to do that fairly? Like, you know, someone I think in the comments wrote about like AI tools for folks with different first languages. Like, great point. Like, based on our patient population, if we want to really solve this call routing problem, do we need to account for a cohort of patients that speaks a different language than English or has heavy accents? Or if you are a pediatric practice, as someone with a toddler at home, like a tool that can make sense and route a call when there's a screaming 18-month-old in the background, you know, those are all things that you want to evaluate based on the specific context of use and the people that you're trying to serve. And I found that preliminary workshop on like, what are the use cases? What are our strategic priorities? Who are we really trying to serve or enhance or enable, you know, with these technologies it'll be the document that everyone keeps going back to over and over as governance evolves, because it's the sort of real goals, or at least the real initial strategy for AI for the organization.
I just double down on what Alia just so eloquently stated. You know, we came up with these very high level guiding principles for the responsible use of AI, right? And they're very similar to many of the other organizations across the country, and professional organizations, right? We want it to be fair, transparent, equitable, responsible, reliable, you know, have privacy, have ROI, have, you know, be safe and secure. But like, it's, no one really knows what that means. And so I loved your comment, which is essentially what we're doing. We're taking each of our use cases through this framework we put together and then trying to define, well, what does fair mean? What does equitable mean? What does responsible mean? And trying to interpret it for each of the use cases. And I think over time, we'll build up a much more like a playbook or a much more detailed set of principles that we can start applying. But right now we're kind of all learning and trying to figure this out. And we're doing this internally. And then of course, involved in some of these other professional groups, trying to learn from other organizations as well.
Excellent. Alia, I'd love to ask you this question. You know, we've heard from many organizations, and you've kind of referenced this yourself, that people are at different points on this governance journey when it comes to AI. What should organizations start to think about when they're implementing or they want to implement a robust governance framework as they seek to leverage AI tools in a responsible and ethical way, realizing that we don't know what either of those necessarily mean right now?
Yeah, I mean, I think the first step is like harmonize definitions, like make sure we're all talking about the same technology here, because the thing that has captured hearts, minds, and headlines in the last couple of years has been generative AI. And there are plenty of old AI tools that are likely already in widespread use across your organization. So before you start to organize yourself around a governance framework that's specific to AI, make sure that everyone's on the same page about the scope of technologies that you are focused on. And if you are going to say, well, now we need to elevate existing processes when it comes to vetting these tools or deciding whether or not they're ready for a pilot or an enterprise rollout, make sure you're doing that in kind of a disciplined way and not, just everything. And I saw calculators like mentioned in the chat, like there are all sorts of, rules-based calculators that are deeply embedded into healthcare IT systems today. And we have for a long time not considered those AI. Unfortunately, like with some of the very broad definitions we're seeing come out of federal and state law, like they might be AI for purposes of compliance requirements. But I think having the organization ground itself in its sort of in a harmonized like definition for the technology is a really important first step. And then you use that definition to actually do an inventory of all of the AI tools that are already in use across your organization. You do not want to be doing that inventory for the first time when your organization has received a letter from your state attorney general asking for the list. That is not the right context to be performing that exercise. So I really think it's one of the best steps that an organization can take is harmonize those definitions, do that initial inventory, and reflect on like how did the stuff that we use today, because you sort of end up in production mode, right? Like what process did it go through, and is our AI governance program really going to be a complement to those existing processes, or do we need something new because we're now looking at tools that are fundamentally different in one way or the other. So those are kind of my kind of foundational building blocks for any AI governance program is harmonize the definitions and know what you're undoubtedly already using.
Mm-hmm. And I think that's a great point you reference, what do we define as AI, right? Because many of the folks in our audience may be using such things as autonomous coding or patient matching algorithms. And technically from a regulatory perspective, they may meet that definition these days. Adam, any additional thoughts from you on this question?
I also think the organization has to figure out where they want to be on the curve of adoption on these technologies. So I really think it comes down to where does it fit in the strategy and what problem are we trying to solve? And I would start there and not just start with, oh, everyone's talking about it, I need to do this, but go back to, is there a problem to be solved? Do we need this technology? And then what are we going to implement? And so I guess just to share on that, I think one of the main challenges just to share kind of our thinking and kind of one of the main areas we're starting with is our clinician and employee experience overall, right? In our health system, that is one of our biggest challenges, right? With clinicians, we're seeing incredibly high rates of burnout. A lot of it is from increased administrative burden, right? While EHRs have had many benefits, they have undoubtedly also glued our clinicians, our doctors and nurses to the computer and made them do data entry instead of focusing on the patient and practicing medicine. And so and the same things with our general employees, right? Everyone's email baskets are overflowing, right? We're on Teams meetings all day. There's stacks of work keep overflowing, and it's very hard to very hard to solve these challenges. And so if we start with that as like our pain point, and then we look and say, well, AI, and particularly generative AI, has some really incredible new capabilities that could be leveraged for this. So that's where we started. And then we decided, let's look at some of these technologies and see where they can help. And I'll just want to share one real example, which is one pain point for physicians is documentation. And I know this group's obviously very familiar with that and spend a lot of time reviewing the documentation and coding off of it. But for clinicians, like often we're seeing patients, I'm like glued to the computer, literally typing everything they're saying so I don't miss anything. And then of course spend hours later, revising my notes, refining them, et cetera. And so we've tried things like speech recognition, which has helped, so you can dictate your notes. And some organizations also use scribes, where usually it was a human that would accompany the clinician and take notes while they were seeing the patient, and then tee up a draft note. There then were, especially during COVID, virtual scribes that weren't in the room but were remote taking notes. And scribes work for some people, but they are expensive and have a relative high turnover rate. And so they're not really a scalable solution. And I think this is where AI and particularly large language models have had a dramatic impact, because the holy grail is for technology to be able to do the documentation and the clinician to be able to focus on the encounter. And so ambient documentation allows you to, with the patient's permission and consent, you record the conversation. The clinician records the conversation between the patient and the clinician. After the recording is the encounters, and then the clinician just does their normal encounter. They ask questions, they do the exam, they verbalize exam findings, and then they discuss the assessment and plan with the patient. And when they're done with that encounter, they hit stop recording. What happens after that is that recording is securely uploaded to a cloud solution, to the vendor's product, where speech recognition takes place, natural language processing takes place, and then large language models synthesize that conversation into a SOAP note, or a typical note with a history of present illness, a physical exam, and an assessment and plan. And these tools, this is like the dream for the clinician, because the clinician can then focus on talking to the patient, doesn't need to have a computer in front of them, and later can review this draft. And what I would say is we have started to use these products. We're testing 2 products in this space. It's called ambient documentation. We started with a very small pilot to assess safety and validity. We saw good results, and now we're doing a pilot with, we have 600 clinicians enrolled in using it. And, some of our clinicians absolutely love this. It has been game changing for them. They've literally gotten quotes like, "I was getting ready to leave medicine until I tried this product." I will also say there are some clinicians that don't like this. It doesn't fit with their workflow or their style, or it doesn't produce a type of the style of the note that it produces doesn't work for them. And that's okay. But this is making a massive impact for a good number of our clinicians. We are formally evaluating this, but our early results from this 600-person pilot are very favorable, and we're starting to make plans to be able to scale this across all our clinicians. And so this is an example. Sorry for the long story, but I wanted to share this because it's not the AI that's driving this. What's driving this is this need that our clinicians are burned out. We need to give them some relief. We need to restore the joy back into medicine, and this technology is an efficient way of doing that. And we're trialing it in using this sort of rigorous approach to evaluating AI. And then, by the way, our AI governance committee is monitoring this, and they will actually approve whether we scale this technology and continue it. So just wanted to kind of fit all of this together, but drive it home based on like not using AI just to say you're using AI, but to have it solve a real need for your organization.
Adam, I'm curious on the topic of monitoring. I think I joke sometimes that I feel like I might be dreaming if a day goes by where I don't talk about AI scribes, because they are just everywhere. And kind of like the product du jour right now in healthcare. And an organization that I work with was struggling with the idea of like, how do we know whether this is working, and at potentially what cost this is working? So in addition to sort of surveying folks who were using this tool, they had concerns about note accuracy, note quality, and it really got at this question of like, what does it actually mean to monitor the performance, the safety, the effectiveness, and the validity of a tool like this? And kind of in a funny way, they had this very high standard in mind for the AI. Like, notes need to be concise, they need to be accurate. But when I asked whether they had ever benchmarked the existing notes in their system against any of those criteria, the answer was no. And so it kind of left the organization in this interesting conundrum of like, okay, well, we know that we want a certain level of performance from the AI, but we really don't have a way to kind of benchmark the AI generated or suggested notes against our historical notes. So I'm curious, like, if how you guys thought about that, or what you mean when you talk about monitoring a solution like that for efficacy and performance.
Yeah, wonderful point. And I do think we have to kind of go back to current state, right? Current state, to your point, we don't monitor, many organizations don't monitor the quality. I'm not sure everyone does, but I would say most do not monitor the quality. And I would say even this has been a problem from the days of dictation way back, and now with voice recognition, same problem. I mean, when I read notes from others, I often see clear speech recognition errors, or even typos from people who type their notes, right? So there is an intrinsic error rate. But I think the problem that you're sharing, which is real, is that we don't necessarily have that benchmarked. At least most organizations may not. And so as we go forward, and there are some I should go back. There are some organizations that do have programs that monitor the quality of documentation. So they'll typically do peer review of those notes. And there are frameworks. I know someone in the comments here cited the New England Journal Catalyst study that Kaiser shared, where they used a framework to rate the quality of notes, I think around 5 dimensions. And so there are validated instruments available to do that. But I don't think that's the common experience. Like, we're all doing it now because we're shifting to we're trying to evaluate these ambient generated notes, but I don't know that we know what the baseline is to evaluate that against. I will say we need to have clinicians review these notes. It's absolutely mandatory. And I do think, and our experience has been, yes, there are some that may not do it, but I do think people are saving so much time that they are willing to go back and read the note and make corrections. And that becomes their workflow as they go forward. And so they spend 2 minutes on the note or 3 minutes on the note because they're just going and quickly editing, as opposed to spending a whole lot more time kind of drafting the whole note. But the questions you're raising are absolutely correct. I will add one more thing that's kind of unique with ambient documentation, and that helps us with the quality question. Ambient documentation comes along with a recording and a transcript of the actual encounter. And that is something that we've never had. There's a whole other numbers of risk and other issues to ask about it, but it allows us to answer this question: was the note actually accurate based on the encounter, at least for things that were verbalized? And so that is a way to actually make a comparison to say how accurate and valid is that note, and something that we never had and would never be able to do even before ambient documentation. So those are some initial thoughts, but I think these are unanswered questions and needs more rigorous attention.
Absolutely. I want to switch gears a little bit and talk a little bit about public policy. For folks in our audience may or may not be aware, a couple weeks ago, the bipartisan Senate AI working group came out with their AI roadmap. This is something they've been working on really for the past year. To what extent, if at all, do you all see the federal government as potentially filling gaps in the governance when it comes to the use of AI?
Yeah, I'm happy to start us off here. So one of the things that I spend a lot of my time reminding folks when they're like, oh, like how do we get ready for these new AI laws that are about to come, and like when's Congress going to act, is like, one, I'd like to definitely make sure that folks are aware of the themes that we're seeing and these proposals, certainly the Senate working plan, but I also like to remind folks that there are plenty of existing laws on the books that already apply. There are no AI exemptions on the books in HIPAA or under the FTC's, unfair and deceptive trade practices framework, or the FDA. And in fact, there are even some relatively new laws. As recently as December of last year, the HHS Office of the National Coordinator for Health IT issued a final rule that sets out certain transparency and risk management requirements for AI functionality embedded or made available through EHRs. So there are, and now there is a new final rule that's specific to healthcare, covered entity healthcare organizations, that anyone receiving federal dollars, to ensure that they are aware of patient care decision support tools that they may use that either use or reference or measure protected characteristics, and to make sure that those folks are taking steps to mitigate any risk of discrimination associated with the use of those tools with those protected characteristics. So there's a whole landscape of stuff that is out there, and I really see the federal policy that's out there is starting to establish roles and responsibilities. Just like Adam mentioned, that there's sort of a spectrum of these technologies, like from low risk, in high impact, to high risk and high impact. There's also a spectrum of responsibilities when it comes to who's doing what and who's capable of mitigating risk across that sort of AI life cycle. So we're seeing some requirements that create documentation and really responsible development type kind of obligations on the part of developers. But we're also seeing a huge uptick in requirements specifically for those organizations that are deploying these AI systems. And I'm kind of calling it like vendor management on steroids, because there is a real expectation that these deploying organizations, a lot of the healthcare organizations that folks on this call work for, are not only asking the developers of these tools questions about, like, how did you develop this? Who is it meant to be used on? How is it meant to be used? What is it going to be fair? And how do I know it'll be fair when deployed in my context of use? The responsibility is not just to ask those questions, but in this latest rule, the Section 1557 rule, the HHS Office of Civil Rights literally says, like, you should be reading media outlet publications. You should be reading peer-reviewed journal articles. You should be talking to your trade associations and your professional membership associations about the risks associated with these tools, essentially putting feelers out everywhere you can to make sure that you're aware of how these tools are performing. Adam referenced this idea of like model drift and degradation. So this is not just like you can look at it at a snapshot in time. You've got to think about how these tools are performing and evolving on an ongoing basis. And the key thing I'm taking away is that everyone involved in this health AI ecosystem has a responsibility here, and defining what it means for your organization to really take on that responsibility, and frankly, like, addressing the resources that you need in order to kind of staff up and upskill and train people to be able to ask these hard questions and make sense of the answers that they get. Should be a real priority for organizations. I mean, gosh, like with the Section 1557 rule, we've got less than a year until it's effective. So the clock is ticking, and I think there's a real imperative from federal policymakers to make sure that people are going into using these tools eyes wide open about their capabilities and their limitations.
Alia, you said it really well, and I think I want to just maybe emphasize one component, which is, we're all learning here, and I think we can't entirely rely on the federal government here. So I think public-private partnerships are going to be really important. There's a number of them forming. One of them I'll mention is the Coalition for Healthcare AI. They have pulled together a number of government groups, academic health centers, large hospital systems, pharma, tech industry, to really start working on what makes safe and trustworthy AI. Can we create the ability to gain efficiencies by having standardized evaluation criteria and metrics that we measure these AI on? So I would also encourage folks to look at, and there are a number of organizations like this forming, but really kind of getting involved in working with peers to dive deeper here.
Great point. I think the other thing too, is putting on my policy hat, right, is, we continue to have an absence of a comprehensive privacy law in the United States, right? To what extent do you all see that as a factor to kind of have Congress move on anything related to AI? Are they tied together or are they completely separate issues?
It's well, for our industry, it'll really depend on how concepts like federal preemption and HIPAA exemptions are addressed in any such framework. Because, there are tons of consumer protection laws at the state level that are comprehensive, privacy laws but a lot of them have very broad HIPAA exemptions so that, essentially entities that are operating in HIPAA regulated contexts or handling PHI, don't need to necessarily tailor their data use activities or their privacy practices to those comprehensive laws. So I think that'll be like how those issues shake out will have a huge impact on how a federal privacy law impacts data use for AI training, development, deployment purposes. I will say though that on the kind of back to the topic of like there are existing laws that apply, Adam raised like this point about, taking a trial-based mindset to some of like AI pilots. There's a real open question under HIPAA of how you characterize the use of PHI with AI systems under the kind of permitted uses under HIPAA's framework. So is it a healthcare operations use case? That you can do, without patient consent, but that really, should have kind of a goal of benefiting your organization, improving quality, et cetera? Or is it really more of a capital R research use case where you're creating something that you intend to essentially will contribute to generalizable knowledge that has maybe more of a commercial R&D kind of bend to the use case because you've got ambitions to, joint develop a tool and, potentially partner with an AI solution or a technology developer to distribute it. There are, we have some, pretty now like aging definitions within HIPAA for those concepts that create a lot of gray area when it comes to interpreting how our processing of PHI in connection with these tools, is characterized. And I think organizations really have to take a close look to decide from a risk tolerance perspective, like where do they want to be in that gray spectrum? Do they want to be in like the closer to like, I'll say like dove gray, light gray side, or do they want to be closer to the inky black because that's what is frankly, important to them from a strategic perspective? Answering that is really key because data is central to the development and the evaluation of these models. Like Adam raised that point about how we now have transcripts and audio files of encounters to help assess the accuracy and the completeness of notes. Like I agree that is incredible. I think you alluded to this, Adam. There's also tons of privacy and security questions about how exactly we use that and learn from those extremely detailed files to improve these technologies. So, the data question is huge, and this is part of like the whole, kind of clean up your house, like make sure you know what data you have, know what rights you have to use it, and have good governance processes in place to use it. And frankly, also start to assess, is the data you have access to and that you can use fit for purpose for the problem you're trying to solve or the tool you're trying to deploy? Because the vast majority of AI harms that are published in the media can be traced back to the characteristics of data sets. And frankly, their lack of representativeness or their inappropriateness based on assumptions and correlations made for the task at hand. So I think this inflection point we're at is adding this whole new layer of complexity and importance to good data governance and kind of documenting data sets and what they're meant for in more kind of purpose-driven ways.
You had such a comprehensive answer, and I really like how you framed it. I would just also add that healthcare is obviously complex, right? And obviously this group knows that because you're managing incredibly complex rules in determining how to code, among other tasks. But data is fundamental, and I do think the challenge right now is with fragmented privacy requirements and data requirements is it becomes increasingly difficult to innovate. So I do think these topics are intimately tied together. And if we could get a unified federal privacy rule and guidance updated, I think that would actually help us move forward faster and accelerate on the AI side.
Excellent. Thank you. So I know we've only got a couple minutes left, and if folks have questions, I encourage you to put your question in the Q&A section of the chat. While we're waiting for some folks to kind of add their questions in there, I want to ask my last final question, and that is, assuming we stay on this current trajectory with the use of AI tools in healthcare, what do you envision for the future of AI in the next 5 years?
I'm happy to start, and I think it's always it's going to take longer than we may think for all these impacts to happen. I think in short term, we are already starting to see some of these lower risk kind of experience-based use cases. We're starting to see impact. So on the provider experience, reducing burden of documentation. We're starting to see it being used for drafting emails or summarizing meetings. So I think those are real use cases that are going to get refined and built out and probably become widespread over the next couple of years. Where I think there's incredible potential is AI for diagnostics and even for treatment in some circumstances. I think that is going to take us some time to first perfect, understand the limitations of, and understand, frankly, how to use alongside other clinical services. So I think that's the exciting future ahead. Just to give one example, and Eric Topol gives wonderful talks on this. When you start applying AI, let's say, to an electrocardiogram, like when a human's interpreting an electrocardiogram, I'm seeing very specific changes in the heart, but AI can determine a patient's age and their gender. It can even determine if they have what their ejection fraction is, if they have heart failure, if they have anemia. So AI can see things that humans, even the most skilled trained clinicians, cannot. But we need to understand the performance of that and how to manage that, and we're still a little bit a ways away from that.
Yeah, I totally agree with Adam that I think the promise is really exciting, and I'll probably focus my answer on the 3 things that I'm kind of looking personally interested in, but the execution and the frameworks that we create to do this safely. I think there's still some open questions about what that's going to look like, and frankly, how we resource and train up to be able to do this at scale, so that it's not just, a handful of organizations with the staff and the expertise that get to realize the benefits of these technologies. And, when I think about the things that I'm really excited about, I think one, personally, I'm excited to delegate the parts of my job that I don't like, so I can focus on the parts that I like. And I think this is a really parallels with the AI scribe example and kind of unleashing clinicians from the keyboard. So I think we are all sort of set to see some real benefits as we get more confident in these technologies and our ability to delegate certain things to them or rely on them increasingly to do first drafts of work, et cetera. The second thing I am excited about is, Adam just talked about the just ability for these tools to process and make sense of information at a scale that just is totally impossible for a human brain. And, there are some types of AI bias that I welcome and would probably call precision medicine, to learn what's working for people like me when they have certain symptoms or have a certain diagnosis. And I'm really excited to be hopefully as a part of a part of a window in the human experience where we get that more tailored feedback. And then the third thing I'm excited about is digital twins for clinical trials. I've been reading a lot about just the potential to use AI generated digital twins as the placebo group for a clinical trial. And I just think about the ethical like wins of not having to have someone with a really serious terminal illness, like wondering whether or not they're receiving a placebo, right? Because you can kind of reliably like recreate that through a digital twin. Like that is something where I don't know if it's 5 years out or longer. I'm really excited to see progress in.
Excellent, thank you. So just time for one or two quick questions. One question we have from the audience is, do you see any impact to the patient consent for treatment to address the level of AI being utilized in the organization that's related to patient care?
I think it's going to depend on what type of AI we're using. I will tell you, and there were a couple of questions on this. So for the ambient documentation, we do, before we use it, we discuss it and get the permission of the patient to use it and record the patient. And if they say they don't want to use it, we honor that. I think some of this is, we should be transparent, but need to understand a little bit more about exactly what the AI is and the best way to do that. So just including it in the general treatment, I don't know that many patients review that in a whole lot of detail. And so if you're truly trying to inform them and be transparent, there may be other practices we need to employ.
Excellent. Another question we have from the audience is, what steps could be taken to ensure things like AI algorithms in healthcare don't inadvertently cause harm due to hacking or incorrect data?
This goes back to that data hygiene point. I think that's critical. Adam, I'm curious like how MGB has been approaching sort of the attack vectors related to certain AI tools.
Yeah, I mean, this gets to our cybersecurity preparedness, which again, it's already critically important, one of our highest priorities, but also needs to be dealt with. And that should be a component of review in any of these AI solutions. So of course, we want to look towards privacy and governance. I also mentioned our information security officer is on the governance group, and we do a full information security audit on all of these tools and really understand what are the data flows, what are the risks, how do we minimize any risks.
Excellent, thank you. So I know, unfortunately, we are out of time. I apologize to folks. We didn't get to as many questions as we'd like, but I thought this was a fabulous discussion. I want to thank our panelists, Alia and Adam, for joining us today. This went way quicker than I expected. I feel like we could have done another hour talking about this stuff. I also encourage folks to check out our AI hub at ahima.org. You can find this website. It's ahima.org education and events section. You can find it on AI. We also have a series of courses related to AI that you can find on the store, as well as articles. Again, I want to thank our panelists for being here, spending some time with us today to share their knowledge, and also thank our audience. So I hope you all have a great rest of the day, and thanks everyone for joining us.
Thank you, Lauren, and thanks everyone.
Thank you.